I have a pregnant daughter due late September who had COVID last November. She wasn't sure what to do on getting vaccinated, so she asked Kaiser to do an antibody test when she found out she was pregnant, and she did have antibodies. Her concern was over the amount of testing that has been done. How could this potentially impact her baby? Should she decide to get the vaccine prior to delivery? She said she has read the immunity can be passed through breast milk, so is currently planning on waiting until after her delivery. What would you advise?
Thank you. So pregnancy, it was interesting. I just saw the questions at lunchtime, and I looked through, I think there's 31 questions or so, and I think 15 of them are related to pregnancy or infertility, which is what, of course, all I see in our practice. And I think pregnancy has been kind of a unique situation. I absolutely understand where patients, women are coming from. It's not easy. You're making decisions for two people. Some of the decisions you're going to impact what you're concerned about for your child's life forever. And so it's kind of a unique situation, I think, with pregnancy. If you look at some of the data, and I know the data changes daily, so excuse me, I'm 3 or 4 days behind, but it's something like 20% of pregnant patients are getting vaccinated, which means about 80% are not, right? And when you look at some of the demographics and you see, nationally what those numbers are, they're on the lowest end of people that are getting vaccinated. So, it makes sense to me. I think what's been interesting about the data that we've seen, and I think we've all experienced, especially the ones of us that are actually participating in patients' care, how many times do you see patients come into your practice or discuss with somebody, and what they say is, well, I've done my own research and I'm going to make my decision. And then you have to, as a practitioner, say, okay, well, where's your data coming from, and who are you getting it from, and where it comes from, and who says it, and who is that person representative of you, is sometimes what patients can't delineate. This data for CDC and vaccinations is kind of raw to me, right? So we're getting it all at once. It's so much that's coming through, and that's why we have things like this, a panel of people trying to answer questions, because it's so hard to kind of rifle through all that information. And so these are the kind of questions that you get. While they seem very specific, there's some kind of generalities to them, and they end up trying to force providers to make statements that are different than what the data is, or try to interpret the data. And that's what's kind of unique about this whole situation to me, at least, my perspective. Do you have a pen? I'm sorry. Of course, mine broke as soon as I sat down at the table. Okay, so there's no question it's secreted in the breast milk, right? You can detect those antibodies in the breast milk. You can detect them, into the baby's milk that's going inside, and that's going to have some passive immunity to the baby. That data is there. There's IgA and there's IgG that gets transmitted. I think that we know that, and you get that from vaccination while you're pregnant. So I think that question is easy to answer. I think people should feel comfortable with that. Let's see, this could potentially affect her baby should she decide to get the vaccine prior to delivery. Okay, so the initial studies did not include pregnant patients, right? Everybody knows that. What the CDC did after to start to include patients is that they started to include patients that got pregnant within 30 days of their menstrual cycle, and then they started to include patients that were pregnant. These patients sign up to things, there's like I think it's called a V-Safe data bank for CDC. It's an app that patients have the opportunity to sign up to, and then they're followed. What you've seen is no change in miscarriage rates. You've seen no change in fertility rates. Miscarriage rates generally run between about 12 and 18% in the population. That's what they're running in the patients that have been vaccinated or got pregnant soon after vaccination. So the data that's been presented is pretty available for that. There's not a lot of it though. So I was pulling it up last night just to see if somebody asked that question. It's about 5,100 patients that they had gotten pregnant within 30 days of vaccination, and about 148,000 patients that had received the vaccine while pregnant. So those are the numbers that the CDC is working on. So I don't know how you kind of interpret that data. You know, ACOG, our governing body, recommends vaccination in pregnancy. Society of Maternal Fetal Medicine recommends vaccination in pregnancy. American Society of Reproductive Endocrinology recommends vaccination. CDC is recommending vaccination. So all of the bodies that we're a part of are recommending vaccinations. I will also say something in terms of the way I see this data. When you're giving large amounts of medicine to a population, it doesn't take very long before you start to see if there's negative effects, just because of the matter of scale that's going on. Now, there's no way anybody can talk about a year and a half, 2 years, 5 years, 10 years. It's not possible. So you have to make some predictions based on what you've seen in the past. But in terms of what we're seeing in practice, in data, we are not seeing it. So my recommendation is, I think it's okay.
All right.